Well, March 20 globally is known as World Oral Day, a day set aside to commemorate the importance of dental hygiene and tooth care. Well, this morning we are talking the importance of dental health to human life. Our guest is Favor Ike Chiku, a dental practitioner at the Federal University of Allied Health Sciences, Enugu. Good morning, Favor, and thank you for joining us this morning.
Good morning. Thanks for having me again.
Yes. So can I compliment you this morning? You're looking dashing.
Thank you so much. It's a Sunday morning, so
yes, definitely.
It goes with it.
Definitely. Thank you for lighting up our studio.
Thank you.
March 20 annually is World Oral Day.
Yeah, World Oral
I remember
Day.
we had this conversation, and I think it was on a call, and you said, "Oh, it's today, so
Yeah,
we
yeah.
are going out for
an outreach.
So tell us, what
awareness.
exactly did you guys do on that day to commemorate? That?
Oh well, that day was an amazing day. It was an amazing day. Usually, 20th March of every year is usually a day set aside, to celebrate World Oral Health Day, purposely to make people understand the essence of, their mouth, the oral cavity. And that day was actually tagged, a happy mouth and a happy mind.
So
that was
the connection between a happy, mouth,
the mouth,
your mouth
and,
and your mind.
Yes. So it's not just, it's quite encompassing, the mouth and the mind. And bringing it down to the psychology of the mind, psychology of the mouth. It's really something one cannot just look at and, say you don't have anything to say about it, because the mouth, like we usually say, or like we usually tell patients, the mouth is the gateway to the body. So everything that passes through the body will definitely pass through the mouth. So it's important you take care of your mouth. If you don't take care of your mouth, it can affect your mind. It can affect your psyche. It can affect your esteem. It can affect your confidence itself.
Yeah, we can still get to that connection. But I wanted to find out exactly the activities that were carried out to commemorate, World Oral Day.
Okay. On that day, we did a rally.
Okay.
There was a rally. Students, medical students coming together, especially the students in the dental field. We did a rally. We went around some areas in Enugu. We had a collaboration with Colgate toothpaste. Yes, we had a collaboration with Colgate toothpaste. We went to Transekulu Girls Secondary School. Went there to sensitize them on the importance of oral health, because it starts from the juvenile stage. Once as a little child, or as you're growing, once you don't have that sensitization of the importance of taking care of the mouth, most of the time that is where halitosis starts from.
What's halitosis?
That's the mouth odor. That is where it starts from. So it's important to let the words begin to know the importance of taking care of their mouth, importance of eating and gargling with water, importance, the right method of toothbrushing. So they don't just go to the bathroom, and most parents to make the mistake of they just wake up in the morning, just drop the paste on the toothbrush, give it to your ward. They just brush anyhow. They don't know how to brush. They don't know how to brush the tongue. So this has sensitization. We did sensitize on that day, making them to understand. And at the end, we were able to give them some little toothpaste, so that the little sensitization, they can go back home and practicalize it. So that was what we did on that day.
Brilliant. Now, what are the common tooth issues that are prevalent? I remember, growing up, there's this dental word, gingivitis or something. So, we'll laugh about it because of it's a serious dental issue. So take us through some of the most prevalent common dental issues that you have come across in your course of work.
There are lots of dental issues, like the gingivitis. The gingivitis is a gum infection, and this gum infection comes as a result of poor oral hygiene.
Sorry to cut you short. Can you give us a description of the teeth and the gum, so that the person watching you can actually have a mental understanding of where the gum is located, so that they will understand and give perspective to what you're saying.
When we are talking about gingivitis, gingivitis has to do with gingiva is the gum. The word gingiva means the gum.
You know, when you open your teeth, you see, when you open your mouth, there's
Yes.
a teeth.
You see the
Where
teeth.
is the gum located?
The gum is located, you know, the sulcus areas, the reddish parts.
The reddish
Parts. Yeah, the
okay.
reddish parts.
That's the gum.
That's the gum. It's called the gingiva. Some persons' own can be red, some persons' own can be black. Most of the time, depends on your complexion. Depends on the complexion. Some persons' own can be red, not like too red, but just a normal reddish. While some can be black. Like I said, it depends on the complexion. Now, and there are cases where you see a patient, the gum becomes so reddish and so inflamed. At that point, inflammation has set in. The gum is being affected.
Please, can you break down inflammation?
Yeah, inflammation is when there is an issue with the gum due to poor oral health.
Is there pain? Is there swelling?
Yes, there are pain.
Okay.
There are cardinal signs to it.
Okay.
You have swollen. You begin to feel some swollens there. You begin to feel some red, some redness there. You begin to feel some white patches around it. Yes, you can possibly eat properly. You can possibly do some certain things you're supposed to do with the mouth. At that point, gingivitis has set in. So once there is a teeth in it, know that there is an inflammation of the gum. There is a gingiva, which is the gum. Once inflammation sets into that gingiva, it becomes a teeth. That is where the gingivitis set in. So gingivitis is one part that affects a lot of people due to poor oral hygiene.
Okay, but what's the predisposing factor for gingivitis? Or
Okay.
what are the major causes?
Majorly, what causes gingivitis? Just like I said, some persons negligence to your mouth. There are people, there are environments you go where people don't even use a chewing stick. People don't even brush. And another thing that causes gingivitis is when the gum recession, when the gum are gradually recessing. And recession also comes when the root of the teeth are gradually being exposed. And the root of the teeth get exposed most of the time as a result of poor method of brushing. Yes, there are methods of tooth brushing. So that's why when we went for the sensitization, we had to let the student understand this is the right method of tooth brushing. You don't take your brush and you just brush like this.
No, you're going to tell us the right way to brush. Now, I've been in well, it was in a church though some years ago, and someone asked a question. I laughed though, but I needed to hear the person said, "I'm a man and I wear shoes and I love to polish my shoes. And when I want to polish my shoes, I take the shoe. I polish it with so much vigor and verve. Shouldn't that be the same way that you polish your teeth to make sure that you get all the bacteria and dirt out?" So what are your thoughts on that? And then take us through the right ways of brushing.
Okay, now most people think, or the traditional thoughts implies that when you brush rigorously, that is when you remove all the accumulations, calculus and plaque from the tooth, from the interproximal spaces. But that is not true. The mouth, it's soft. It's a soft tissue and a hard tissue. We have the soft palate, we have the hard palate. The gums are soft tissues. So you're not supposed to do a rigorous brushing.
As though you're polishing your shoe.
As if you're polishing your shoe. It's supposed to be tender, it's supposed to be soft. You're supposed to massage the gum. So you're brushing, you sweep it. And your toothpaste you take is supposed to be on a peanut size. It's not supposed to be when you draw it like we were taught while we were growing up. So we used to have this mind that when you draw it.
No, those were the commercials. When they want to apply it, they apply it from the beginning to the
But that's not the ideal thing. The toothpaste is supposed to be a peanut size. Then you sweep the toothbrush, the bristle will be in between 3 teeth. Then you sweep.
From inside out.
From inside out, you sweep. When you go inside, you sweep it out.
Okay.
You sweep it out.
Okay.
You sweep it out. When you're doing it like that, you're helping the gum. Okay. But when you're doing it rigorously, the gum gets recessed. the neck of the tooth gradually is being exposed.
Yes, going down,
start going down. It exposes the root, and once the root start getting exposed, there is tendency for sensitivity. Sensitivity can set in. The patient or the person might start feeling some shocking sensation. You can't take cold water, you can't take hot water. You feel some shocking sensation. So at that point, gingivitis can set in.
Now, before we go over to other types of oral issues, there's this. I think I read it somewhere. There when you see your toothpaste, sometimes towards the tip you see some colors, some coloration. Some will be blue, some will be red, some will be black, some will be green.
Yeah.
It means something, doesn't it?
It's just the chemicals and the how do I put
so
it?
Which should we go for when we go to buy our toothpaste? The greenish one, the reddish one, the black one, or the blue one?
Well, when it has to do with toothpaste, we tell people, even though we don't advertise
in terms of brands.
Yes, we don't recommend, we don't advertise. But what we tell people, the toothpaste that is good for you, that is compatible with your oral cavity, might not be compatible with other person's oral cavity. So when you're using a particular toothpaste, take for instance you're using Oral B. Oral B might be good with your oral cavity. You use it in the morning, you brush by 7 in the morning, from 7 to 12, 3 in the afternoon, you still feel some fresh breath. Some other person can use that Oral B from 12 o'clock, especially when you don't talk more often, you don't take in oxygen and you don't emit carbon dioxide. You start having some pungent smell. And the most important thing one should look out for in a toothpaste is this toothpaste, does it have a fluoride content? The fluoride content. Does it have fluoride in it? If it doesn't have fluoride in it, it's not something you might possibly look out for. So it's not on the basis of if the color, you just look out. If I'm using Colgate, this Colgate, when I use it, how do I feel? There are some person when they use, I've heard patients say, I use this toothpaste and my saliva is always looking very whitish and very thick, which is not supposed to be so. It's supposed to be when you brush, use the toothpaste, your saliva, you secrete, look very white and colorless, free.
All right.
Yeah.
You mentioned tooth sensitivity.
Yeah.
I remember some people, every one of us has actually experienced this.
Yeah.
You are eating and suddenly one huge Olumo rock
just
finds its way between your teeth and you're like biting hard. You know, exactly.
Yeah.
Now, when one has that kind of experience, what is the kind, maybe first aid or something you can do to avoid? Because subsequently you find out that if you take cold water, you avoid that side.
Yeah.
If you want to eat, you avoid that side for some time. For some people, it actually degenerates into toothache.
Now,
what are we supposed to do to avert toothache? You know, are there some, tips that you can apply immediately? If it eventually, turns into toothache, what do you do?
Okay, now the first thing from your question, you're eating and most of the time some food particle lodges in between the...
Not food particles, stone.
Some stone lodges.
You chew it as though you want to, you chew the stone.
And most times you create a crack, or the tooth gets to fracture.
Absolutely.
And when those tooth fracture, most of the time that is where toothache starts. Because in that fracture, there are tendencies that it might expose the dentine. The whitish part is the enamel. The one inside the whitish part is the dentine.
Okay.
So that whitish part, when you're eating any food that contains a stone, and maybe one reason or the other you have a crack or a fracture, you get to expose it. At that point, usually, what we advise, we might ask the patient to use the salt water and salt, hot water and salt. Hot water and salt to gargle for a while.
Not warm water.
No, not when you're talking about warm water, some person can go and get a water that even the little child can put his hand inside.
Okay.
And you don't get the effect.
Okay.
You get the water at least that is about 50 to 60 degrees hot that your mouth can carry.
Okay.
You just a little pinch of salt, use it to gargle. While you're gargling with it, you can look for any of the paste, sensitivity toothpaste like Sensodyne. You can use that to to stop the sensitivity. But if peradventure it persists, we can ask the patient to go for an ROCT, a root canal therapy. You just to kill that tooth, to avoid that, and you kill the tooth and you feel it, so that sensitivity can stop. But usually, apart from the crack, apart from the chewing of the food and the stone, most of the time, what causes those sensitivity are the way we pick our tooth.
Indeed.
Yes.
Not flossing.
The way we pick our tooth. Yes, we are supposed to be flossing. But how many of us floss? How many of us floss? You can be eating and something gets into your in between your teeth, and we just needed something at the urgent to just
relief.
At that point we just get a toothpick, and the toothpick has caused a lot of harm. For most persons you see that has sensitivity, the gums are exposed, gum recession.
What sort of toothpicks? Because there are some that come like this, like an F.
Yeah, even the one that comes with an F, the part
the
that is sharp.
part.
Yeah, the pointy part that is sharp is not. You're not supposed to use it. You're supposed to use the part that has the line. You just put it in between the interproximal. You just shake it. The food comes out. But most of the time, even the flux, most people don't know how to use it. They feel that pointy part is the part that you want to use to choke in between. And when you're choking it in between the interproximal space, you're gradually exposing that tooth. And as you're exposing the tooth, it's called periodontal pocket. Over time, that particular tooth keep getting exposed. You get exposed, the gum there that is supposed to be holding the tooth firm, the gum keep getting exposed. And it gets exposed to a point where when you eat anything that is citric, hot, you begin to feel some sensitivity, some very bad sensitivity. So good flossing is good. And
can you use normal thread to floss, or must it be something psychedelic?
Yeah, there are some.
What materials do you recommend we use to floss?
There are some flossing that are not like the ones you've seen. There are some flossing that come like a thread.
Really?
Yes. There are some flossing that comes, if you go to some conventional supermarkets, you see it. There are some flossing that comes like a thread. You just cut it, and in between, you just hold it.
Yes.
You just put
just like a thread.
Yes, like a thread. You just move it around. You leave it, you pull it out. Whatever is there goes off. It's better than punching in between the interproximal space just because you want to remove a food.
Right. Tell us about plaques and dental caries.
Well, plaque is a transparent film. Most of the time we don't see it. It's usually there in the mouth. It's usually there even after you brush. A plaque, you can see a plaque. They are usually transparent films. You don't get to see it. But
why are they a problem if it's transparent?
It's there, but it grows over time when you are not brushing properly. When the oral hygiene is poor, over time you realize that the plaque is looking like a water. Yeah, it looks like a water. It's transparent. But when the oral hygiene is poor, over time it begins to grow. It grows gradually into a whitish stick, a whitish butter. Yes. From that whitish butter, that's a plaque. Most people will use their toothpick, they just bring it out. It looks like a butter.
So it's removable. It's not like hard.
It's removable. It's removable. The plaque is what now, generates into a calculus. The calculus is one that is now hard, that looks very yellowish, that you can't possibly remove it without ultrasonic scaler. That's for the plaque.
Okay.
But for the dental caries, a lot of things can lead to dental caries. Majorly poor oral hygiene. We always talk about poor oral hygiene, how you take care of your mouth, how you brush, what you eat can lead to dental caries. Dental caries is just is a cavity.
A hole inside.
Yeah, it's a cavity. It's a tooth infection that could come as a result of maybe you're not brushing properly, you don't gargle your mouth properly, or maybe for some persons who feel their teeth is so strong they can use it to open up a bottle drink. And immediately you have a crack there. And those caries, they are progressive and irreversible. It comes like a point. Once it comes like that, it begins to grow until it grows to a point where it becomes so big. So most of the time, when you don't notice it on time, it grows into something. Most of the time, you end up losing that tooth. And substrate sugars too can cause dental caries. The kind of sugars you take, and most of the sugars we take when we eat at night, some food we eat at night, and we secrete saliva, they come in contact. That's why it's so important to brush at night. When you don't brush at night, the kind of saliva you secrete can never be as fresh. So that saliva interact with the sugar substrate overnight, and it leaves a lot of garbage on your mouth. You wake up in the morning, you realize that even your gum is paining you. You don't even know what's happening. The gum is just paining you. The teeth, the environment of the teeth are not comfortable. You begin to ask yourself what's happening. Well, it's as a result of what you've just taken. So when you take those substrate sugar, you get to brush at night. And when you wake up in the morning, you don't need to brush. You just need to take water, eat, then you brush.
Okay, let's get back to the calculus. You said
Okay.
in removing it, there's a procedure.
Yeah, procedures.
Now,
Yeah.
can children go through that procedure and explain the procedure quite briefly?
Okay, calculus, for some persons who have calculus, most people have calculus,
Yeah.
but they don't know. If you don't have it at your anterior, at your
Yeah.
front tooth, you have it on the inside, the posterior. So, and these are the reasons why people have mouth odors too. When the calculus is much. So we advise people, visit your dentist, go for scaling and polishing. Because the scaling and polishing is the normal tooth washing.
Okay.
Yeah, the normal tooth washing, but it's not like the one you brush at home. Your toothbrush cannot remove the calculus. Calculus can grow to a point where it can even cover the whole of your white teeth. They will not be seeing the white tooth, they'll be seeing just the calculus. So at that point, you brush. I've seen patients who calculus everywhere, I can't even see the teeth. And you ask the patient, do you used to brush? The patient will tell you, yes, I brush. But your brush, even if you're using the hardest of toothbrush, you cannot remove it. At that point, go to and see the dentist. We use ultrasonic scalers.
It's compatible. Kids can
go for it.
Okay.
Kids can go for
Adults,
it.
kids.
Adults to go for it.
Pregnant people.
Anybody can go for it. You go for it. Actually, it's advisable to go for it twice in every year.
How often should someone visit the dentist?
Twice.
On a normal basis?
Twice. On a normal basis, if there's no issue, nothing, twice in a year you visit your dentist, and always check your mouth. People don't care about their mouth. People just feel, once I brush in the morning, I'm good. For the ladies, once I do my makeup and put my lip globes, I'm okay. People don't check their mouth. It's always important once in a while. Check your breath.
How do you check your breath? You know, there's this adage that says, on your own, if someone has a bad breath, you cannot tell. It's someone that is very close to you that can say that, oh boy, you get a bad breath. So how can you check?
Most of the time, that is not true.
How can you check that and know that for a short you have a bad breath?
If you have a bad breath, you will know. Most of the times, you perceive yourself.
Okay.
You psychologically perceive yourself. Don't bring your mind to it. Perceive yourself. You will know. Yes, you will know if you're having a bad breath. And for most people who don't, I know most of the time it's not good to talk too often, loquaciously, but it's advisable to communicate. Communication with people helps you. If you are having the environmental bad breath that comes as a result of maybe when you don't talk and you just gather some level of carbon dioxide on the inside. So the moment you talk for maybe you've not spoken for 1 hour, 2 hours, when you talk, someone will feel that effect that you've gathered a whole lot on your inside. So even if it's a hello, how you doing? How is work? How is it going? That alone is enough. You're taking in oxygen, you're emitting carbon dioxide. It makes the mouth, it flourishes the mouth, it makes it
now,
fresh.
are there some people that are born with mouth odor? Aside the fact that poor hygiene or brushing properly and adequately can cause oral, odor.
Yeah.
Are there people who are, because there are people who are born with body odor of some sort and they have to seek medical help. Are there people who are born with mouth odor? If not, what are the other ways aside not brushing well that someone can actually acquire mouth odor?
Mouth odor is not hereditary, it's not genetics.
Okay.
It's not hereditary, it's not genetics. Mouth odor comes generally. Negligence is one of, like I said, growing up is a factor. Growing up is a factor. Once a parent neglects that duty of looking out for the word's mouth, the oral cavity. In fact, there are kids that are having issues, calculus all over their mouth. Their mothers are not aware of it.
Yes.
And when you call the mother and say, have you seen this thing? The mother will be like, how did it start? Where? That's a negligence. So it's one part. And when it happens like that, they will want to tell me that it's hereditary or genetic. It's not genetics. When a child of 1, you want to give him a toothbrush to start brushing at the age of 1, 2, it's not correct. This child still needs to be groomed. Even at the age of 3, the child needs to be groomed. Sometimes they do the brush, sometimes they lick the toothpaste. They lick it, yes, and they tell you they brush. And you see that child, over time, the child begins to, and they don't brush properly, and you give them some kind of food, and you don't teach them how to take enough water, gargle when you eat anything. What do you expect afterward? The mouth odor gradually start coming up. And when it gets to that point, halitosis has come in. And there are cases where it's just psychological.
What do you mean by that?
Psychological, where most times we feel we have mouth odor.
But you don't?
But you don't.
Really?
Yeah, most times.
Take us through tongue care, because you have told us how to brush the teeth from inside out, in an outward fashion. How do you brush your tongue and ensure that it is clean?
Okay, the tongue.
You know, some people actually say the main reason for mouth odor is a dirty tongue.
Tongue is part. Tongue is part of it.
Okay, take us through.
Tongue is part of it.
Of the tongue.
Usually when you brush, we have what they call the tongue rake.
Tongue.
The tongue rake.
Rake.
Yes. We have what they call the tongue rake, but not everybody is aware of it. You use it to rake the tongue.
Okay, so it's an apparatus. It's a tool.
Yeah, it's a tool like a toothbrush. You just use it to rake the tongue.
Really?
Yeah, they have it. But aside this tongue rake, the toothbrush too does its own work. The toothbrush does its own work. One of the things about the tongue, most persons who also have the mouth odor is from the tongue. People brush and they don't brush the tongue properly. You just do it. You just want to do it. Let me just do it fast and let me just go. In fact, you should focus more on the tongue than even the teeth, because the saliva that is being secreted is not from the tongue. It's from the tongue environment. It's not from the teeth. So that saliva that is being secreted, the food you eat reacts with the taste bud. The taste bud and everything are in the tongue. So when you don't brush the tongue, you just do it anyhow, and you not eat some certain food, and they react with that tongue. What happens? And some tongue you see, it look very white. That's why the tongue rake is very important. When you use it, you bring out some white. You should be asking yourself, how did it happen? So brushing the tongue, not rigorous brushing. I've seen people, most times you see people brushing their tongue, and you are here, and from a distance you hear that they want to bring out the tongue. No, the tongue itself needs to be massaged because it's a soft tissue. It needs to be massaged.
All right, tell us about oral thrush before we go into the aesthetics of dental care.
Okay.
Tell us about oral thrush.
Oral
thrush. The coating. There's this coating, fungal coating of some sort of the tongue.
Can you break it down?
I can't break it down. That is why I'm asking you. All right, so let's talk about the aesthetics.
Okay.
Aside the fact that there are some procedures that are meant to keep your oral environment healthy and clean, tell us about the aesthetics. The ones that once someone becomes a celebrity, you whiten your teeth, you straighten your teeth, you close the gaps, braces, things like that. So in a nutshell, just tell us about the aesthetics. We
have a lot of things that can possibly build aesthetics. A whole lot of things that could build aesthetics. Apart from the tooth whitening, apart from the braces, we have the tooth whitening, we have the braces, we have the veneer, we have appliances, dentures, and so many of them. Tooth whitening is very important. A lot of people are doing it now. A lot of persons are doing the tooth whitening now, especially for persons who most smokers and people who have discolorations, discoloration as a result of excess fluoride. You can go for tooth whitening, it helps. Some persons who have malaligned dentition, malposition dentition, and really needs to, correct it. It's a correctional treatment. You do it most of the time, just to ensure that the dentition are in the proper shape But most times that aspect, you know, hinders a lot of people from certain things. You know, you want to face the crowd, you want to communicate, you want to relate. But when you look around, you discover that one or two things are stopping you. And someone was telling me yesterday of one celebrity, Ojo, is a lady. Say, the teeth was not like this before. All of a sudden, the teeth is now looking brighter. And what happened? What did she do? The person sent me the picture. I saw the picture of the former and the recent picture. I said, this person must have gone on cosmetic dentistry. Must have done something to help, because that will build your confidence back. It will give you it will increase your profile.
Are there any side effects?
Many a times it depends on where you're doing it and how it's being done. The side effect, or if you're going with tooth whitening, the side effect of it depends on, just like I said, look at this cup. This cup is white. This is not the whitest color of white.
Shade of white.
Yeah, this is not the whitest shade of white. So if you're having a white that is a bit dull than this, and you want to do a tooth whitening, it's better for you to leave it at this shade than you telling them that they should make it more whiter than this. If it's more whiter than this, there's a possibility that the tooth, it can affect the tooth. You can start having some bad sensitivity at that point, and visiting often.
All right, so we have actually run out of time, but I want you to give us tips, dental tips, oral tips that someone watching you can actually, you know, start practicing and improve his or her oral health. I know you've mentioned gargling after eating.
Yeah.
Right way to brush. What are other tips that are available?
Okay, I mentioned gargling. You know, gargle with water when you eat, no matter how little the food is. Get to gargle properly. Ensure that your mouth is free of every...
Gargle and swallow, or gargle and spit
gargle
out?
And spit out. You gargle and spit out. Ensure that your mouth is free of every form of, you know, food accumulations, because it can lead to mouth odor too. Another thing is floss as regular as possible. No matter what you eat, get a floss. Always ensure that you floss very well, and do your brushing properly. The right method of toothbrushing.
Yes.
Brush properly. Don't just. It's not a vigorous. It's not a Second World War. No, it's not a Second World War. It's something.
Massaging.
Yeah, you massage it.
Right.
Gently. You're doing it, and most importantly, take plenty of water.
Oh wow, interesting.
Take plenty of water. I tell people this over time.
Yes.
Water is the best therapy.
Yes.
To life, to health, to skin, to everything, to even to the growth of the hair. Water helps. All right. But we neglect it.
Thank you so much, Favor Ikechukwu. It's always a pleasure having to talk to you. I'm sure you must have learned a thing or two to enhance your oral hygiene and oral health. Well, New Day continues right after this time out. Stay with us.